what is the overall process of TMS? So with Neuralia, for instance, we do it this way. So we start off by doing a history, by doing an interview with you to know that you are a suitable candidate for TMS, to know about your story, to know why you're needing treatment, and how we could best help you. We'd also need to make sure that you don't have epilepsy, which would be an issue for treating you with TMS, or you don't have any magnetic material embedded in your head or neck, things like aneurysm clips, as that would be an issue. So that's done through the initial history, which I'll be part of. Now, number 2 is the mapping appointment. So the mapping appointment is the very first appointment where we do the calibration, where we measure your head, where we locate the coordinates of the prefrontal cortex, which in most cases is the treatment location for treatment of depression and anxiety. We do that through a variety of different methods. We sometimes use MRI-guided neuronavigation, depending on the treatment location. Sometimes we use tape measures. There's a few different options, but they generally involve a computer and algorithms as well. During that mapping session, we have 2 goals. One is determining the treatment location coordinates, which I just spoke about. Number 2 is determining the resting motor threshold. So the resting motor threshold is the minimum magnetic field intensity required to cause a nerve in your brain to fire. Now, we all have a number that will, on the machine, that will cause our nerves to fire. And if your nerves are not firing, at least during the testing phase, we're really not doing an awful lot for you. Of course, I could max out the machine to full power, and your nerves will definitely fire. We'll be able to see that. However, it's not comfortable at all. What we want to find is a minimum magnetic field intensity required to cause a nerve in your brain to fire, which is the resting motor threshold. Now, around about here's my prefrontal cortex. That's the location I'm trying to target. That's where the nerves responsible for mood regulation. It's not the only part of the brain that's responsible for that, but it plays a role. That's where it's located. Now, I would ideally like to see a prefrontal cortex nerve fire to make sure it's working. However, there is no visual cue. I would have no idea if it was to fire. However, I can see when a motor nerve fires, which is why just for this session, the mapping session, we're going to move towards the motor strip, right about here, if it's my left side, here on my right side, in line with your ears. We're going to move over there, and from a central nervous system point of view, the hands are easy to reach. So we're going to get the coil, and there'll be a video on this on our website. We're going to get the coil, and we're going to target it at that area and get it to the point when, if you look at my fingers, you get a bit of a twitching of the thumb and index finger. When that happens, and it happens involuntarily, then we know that your nerves are firing, and we find out the minimum amount that's required to cause that to happen. So that's the mapping session, and I, as a psychiatrist, a TMS psychiatrist, will be very much involved in that. Then you've got the treatment sessions. So for the depression protocol, for instance, there are 3 to 5 treatment sessions a week for approximately 7 weeks. Neuroplasticity does take time, and it takes about 3 weeks to start seeing a result for most people. So during these sessions, you're going to come in, you're going to take out some of your stuff in your pocket, you're going to sit down on the recliner chair, get yourself comfortable, maybe have your legs up, and then we're going to place the coil over your head. You might be having a chat with the nurses, you might be watching some Netflix or some Amazon on the TV, but we hope we'll get you to a point where you're quite relaxed. During the treatment, you'll feel a flicking sensation. That's what TMS feels like. It shouldn't be painful. In the past, when we had very old machines and older tech, it could be quite uncomfortable. But with the newer machine, it should not be painful. It will be felt like a flicking sensation over your head, even though there's actually no contact between the coil and your head. There doesn't need to be. So the next stage is the mid-TMS review. That happens around about session 15 to 20. This is where we just make sure you're improving, and if not, we're going to make some changes to our protocol and find out why, and we're going to dig into it a little bit more. Around about session 30 to 35, we do a final review, and generally I'll be chatting with my patients to make sure that they've had a good experience, to see where we got to in terms of results, and to give a plan going forward and liaise with the GP and communicate through a letter. So that's part of the key stuff that we're kind of talking about.